Right now, we're talking about coronavirus. The world is on the brink of a coronavirus pandemic as the spread of the disease reaches 38 countries. Well, as we speak now, it's risen to about 50 countries, now confirmed that every continent has recorded cases, with Europe and other countries in Asia, with Italy, Iran and South Korea the new hotspots. Schools have been closed, football games suspended, fashion shows called off, and the world is now being battered by the flu disease we started late last year in central China. So far, the number of persons infected with the virus has reached several thousands, and I'll take you through some details as we go along. Now, the coronavirus is spreading more quickly in Europe, the Middle East and other parts of the world than in China, where the virus first emerged in the central city of Wuhan at the end of last year. Today we speak to Chinese journalist with state broadcaster CGTN Xuejia Gu to explore how the media has handled its coverage in China and what the world can now do to defeat the virus. We'll also hear from the Ghana Health Service on Ghana's state of preparedness as well as some Ghanaians locked up in Italy, where many places are under lockdown. First, though, Deputy Head of JoyNews' Health Desk, Kojo Yankson, with our top story.
The novel coronavirus, COVID-19, will go down in history as the deadliest of its family, infecting 81,000 and killing 2,600 so far. A disease similar to the common cold, it can be so fatal and alarmingly contagious. The major concern, though, is that it is spreading very fast across the world, with 30 countries so far recording cases. China blames this on the panic reaction by some countries which evacuated their citizens from Wuhan at the start of the outbreak.
You can reach the conclusion that we don't have to be panic. That's what we are panic for. So, because, every day we suffer different diseases. The cases outside of China, the most confirmed cases outside of China has been caused by what? Caused by the evacuation of their citizens by such countries as the US, France, Germany, Canada, Australia, South Korea, as well as that cruise. At the beginning, these few countries, when the outbreak started, these few countries, led by the U.S., rushed to evacuate their citizens to their home country, and on the way of traveling, they were infected. So this is the situation.
That is the headache of the WHO and other public health experts across the world today. In Ghana, government has handed 2.5 million cedis to a team of experts working to prevent an outbreak or spread of the virus in the country. It is part of a 35 million cedi budget needed to effectively prepare and contain a possible outbreak.
Called primarily as an interactive section by giving you some briefing, and want to open up for discussion so that we can clarify a few issues that are going on and make sure they have a deep understanding. That's why we have asked for the cream in the media to be here, because you are the one who sets the agenda, initiate the discussions, and your moderation and a deeper understanding of the situation is going to be very helpful for the actions that we take. The minister will join us towards the end, and if there are any, if possible, he might join us towards the end. Briefly, I'm sure we are doing more than 2 months now since this outbreak started. So discovered in December. It may have started somewhere in November, but of course, in all disease outbreaks, it takes a while before you start picking a trend and it is identified. So far, Ghana has tested about 15 suspected cases, and all of them are negative. A lot of the time, the tests are taken in the night, and so you probably receive your results around 1 a.m. or 4 a.m. And we are all on tenterhooks waiting for the results to drop from Noguchi. But so far, we've not had any challenge. Our response has been, first, in terms of coordination. We've met all our key actors, the teaching hospitals, the regional directors, immigration, port health, etc. All those who are likely to be part of this have all been met, and we've had been deliberations. We've had much more than...
Temperature scanners have been installed at Ghana's entry points as part of measures to detect any case right at the point of entry.
You would have declaration forms to fill.
Which is here?
Yes.
Okay.
And a passenger is coming with the form. She's the one coming. Okay. So after filling the form, she'll go through the screening, the thermal scanners. So it will pick the temperature. If it is above the threshold, it will show red. But you see this one is showing green.
Okay, so on the computer we see
it show green, yes.
Which means she's okay, she's not sick.
Yes, so if it is red, then quickly, we have so many officers around. We escort, we ask the travel.
Experts have also been undergoing periodic training on how to communicate an outbreak should Ghana record a case.
As health promoters, we are mandated actually to provide education to the public, to provide advocacy, and also to communicate risk. Aside these, we are also to manage the rumors because we do not want to create panic. As you know, these do have influence on businesses and other activities of the country. So over the last few months, we have been working to put together, to put in place the National Risk Communication Response Plans. We have developed key messages and alerts for the general public, and especially for our port of entries. We have also developed jingles for the airport and the that's international arrivals. We continue to engage the media.
In Parliament, Health Minister Xuejia Gu gave this briefing on the country's preparedness to the House and pledged Ghana's support to China in fighting the virus.
Stakeholder engagements have started, and we have actually met the authorities of Kotoka International Airport, Tema Port, and Ghana Airport Company Limited. Furthermore, Mr. Speaker, we have held a meeting with the Chinese ambassador to Ghana and discussed issues related with regulating high-risk travels to and from the affected areas in China. Active surveillance within the country, as well as the points of entry, has been enhanced. Mr. Speaker, case definitions have been developed to help clinicians detect potential cases and manage appropriately. We have sent alerts to regions, teaching hospitals, and points of entry on the outbreak. The alerts also detailed clinical features of the infection and gave guidance on prevention. Sensitization and training of healthcare workers and all other frontline staff, especially at the points of entry, port health, immigration SEPs, and training of staff at the designated treatment centers have started and are ongoing. Large-scale awareness and training of health workers are also planned for immediate rollout.
In his State of the Nation's address to Parliament last week, President Akufo-Addo took time to express Ghana's sympathies and support the people of China in dealing with the virus.
There is a sizable Ghanaian community in China, and our government through our embassy has been working with the Chinese authorities to find the best way to deal with this situation. The Ghanaian community includes 4,760 students, out of which 300 students are studying in Hubei province and 200 in the city of Wuhan, the epicenter of the outbreak. We have a delicate situation on our hands, Mr. Speaker, and it does not benefit anybody to try to score points by introducing ill-judged politics into this ongoing medical conundrum and humanitarian tragedy. Most of these students are on Chinese government scholarships, and since the crisis started, the Chinese government has done its best to keep them supplied with food and other logistics. The Ghana government, through its mission, also supplies logistics, and the embassy has given, so far, 500 United States dollars to each student. However, we know that no amount of logistics will make up for the extreme stress and trauma that these young people are going through, and I treat members of this honorable House to set an example by helping to pour oil over troubled waters instead of instigating tension and spreading fear and panic among the young people. The government is in constant touch with experts on the subject, who advise that the basic principle of public health is to confine the disease to the area of its origin. But we have not ruled out the option of evacuating the students from Wuhan if that becomes necessary. We have put in place measures to ensure that their evacuation back into Ghana, if it happens, does not lead to the dissemination of fear and panic amongst the general population.
But now the support will not only be for China, but for the rest of the world and Ghana itself. Here, Noguchi Memorial Institute for Medical Research has been speaking about its readiness to deal with an outbreak.
Get to see exactly what happens there too.
Here, and then we add this here in this group. So you see it's completely separate from the other room, okay? Yeah, and then we bring them into these machines, 4 machines, and each machine takes a 96-well plate. Yeah, so these are called real-time PCR machines. So you see the results as the test is running. So when you do like a polymerase chain reaction, a PCR, for most of it, you have to first run a gel. So this will take a very long time. After the process, it takes like 3, 4, 5 hours. Then you have to run a gel for another 1 hour before you are able to see your products. I think we are able to work late into the night and all that. So people should not panic.
But you don't run 24/7?
Sure. Not really. I think when we have our results and everything is fine, then we are allowed to go home and sleep. But if like we need to stay, we always do that.
So that's a report put together by Kojo Jansen, deputy head of our health desk. I beg your pardon. Like I said, we're going all the way out on coronavirus. Yesterday, there was a press conference by the United States President Donald Trump talking about what they intend to do. Well, how is the world managing this? How fast is it even spreading? I have here in the studio, like I indicated earlier, Xuejia Gu. She's from CGT, and we'll talk to her. But then the WHO representative had indicated her participation in this conversation today, but has had to back down due to some emergency that they're having to deal with. Right now, let me welcome you to the studio, Xuejia Gu.
Pleasure to be here, Gifty.
All right. So before we start the conversation, I'd like to give you an idea how fast this virus is spreading across the world. So this gives you an overview. Let me begin with mainland China. What's happening in mainland China, where this virus originated from? At this point, what do we know? So we're looking at 82,549 cases that have been confirmed. That's the total cases confirmed. And then if you look at that closely, 2,810 people have died. Remember when I started the show, I gave you a figure that's different from this one right now. This is a live update. It gives you a live update on what's happening. 2,810 people have died in the Hubei province alone. If you look at the number of people who have been treated and who have actually recovered, you're looking at 33,252. Now that's a number larger than the number of people who have died, which shows some good news there, despite all the number of people that have died. If you go to South Korea, it's one of the other countries apart from China that has really suffered a lot. Now in South Korea, we're looking at 1,766 confirmed cases. Out of that, 2,810 people have died, and 33,000, well, looks like I'm still on China. Let's go to South Korea. Okay. So South Korea, right, South Korea, we have 1,766 cases confirmed. 13 people have died over there. 22 have recovered. Again, a better number in terms of recovery rate than the number of people who have died. If you look at others, what do they mean by others? The others mean those that were not, the people who did not contract the virus in any particular country. So we're looking at the cruise ship on which there were a number of people, and we're told that on that cruise ship alone, there was a widespread of the disease because they were concentrated in one particular place. Now, on that alone, we're looking at 4 people have died in that alone, but 10 people have also recovered. Again, better recovery rate we're looking at there. Italy is the latest country to have been hit that has become, if you like, the hotspot, the latest hotspot. They have recorded 453 cases so far. And out of that 453 cases, 14 people have died. Again, a good outlook, 40 people have recovered. That is Italy. In all of the countries, so there's 528 recorded cases, I beg your pardon, 528 in Italy. 14 people have died, 40 people. And I'm just taking you through the hotspots, and when we're done with that, I won't go through all of the countries. There's about 50 of them. I won't go through all of them, just a few hotspots, and then we'll go down to where there are very few cases recorded, which means that there's an emerging trend there as well. If you look at Italy, we're done with Italy. Let's move on to Iran. In Iran, the number of people that have been infected, or the total confirmed cases in Iran, 245. Out of the 245, we're looking at 26 people who have died. Again, quicker rate of recovery there. 49 people have totally recovered from that. And then I'll end with Japan. I'll end with Japan, which is one of the earliest countries to also record cases. What is the number we're dealing with in Japan? We're looking at 189 confirmed cases. 3 people have died, and again, 22 people have recovered. I'm going to take you all the way down from Japan. We go to the countries that have recorded very low. So there are several countries here. Well, perhaps we can go through that. There is Singapore, there is Hong Kong, there is the United States of America, and like I said yesterday, there was a press conference there. $2.5 billion has been allocated to deal with it. There's Thailand, there's Bahrain, there's Taiwan, Germany. 27 cases, we understand, has been recorded. Kuwait, Australia, Malaysia, France, Vietnam, Spain, United Arab Emirates. And what's happening in the United Arab Emirates? We're hearing that in Saudi Arabia, the pilgrimage has been, the usual annual pilgrimage has been cancelled, also looking to reduce the number of infected people. The United Kingdom, I'm just reading some stories from United Kingdom right now, and they're saying that in Canary Wharf, there is there are fears there could be some sort of infection over there as well. Some schools, including Princess Charlotte's School, has some students, they have gone into self-isolation with fears that there could be, the coronavirus could be there as well. Canada has a number of cases as well, 11 we're looking at. Macau, Iraq, Oman, India, Philippines, Croatia, Israel. There is also, and there are 2 cases in Finland, Sweden. So these are the countries that seem to now be recording emerging cases. You have 1, 2 in all of these countries. There's so as far as we're talking about Africa, we're seeing that there has been recorded cases in Algeria. We know there have been recorded cases in Kenya, from where Xuejia is coming from. We'll talk more about that one later. But just so you know, we're looking at 3 in Philippines, 3 in India, 3 in Croatia, 2 in Israel, Finland, Sweden, Russia, Pakistan, Lebanon, Austria, Afghanistan, Nepal, Cambodia, Norway. Remember, President Akufo-Addo is in Norway at the moment on a trip, working trip, but Norway has recorded 1 case, we understand. Algeria, Belgium, Georgia, Denmark, North Macedonia, Switzerland, Brazil, Romania, Estonia, Egypt, Greece, Sri Lanka. All of these countries that I have mentioned at the bottom of the list have recorded 1 cases each in all of these countries. So we're still counting, like I said, across 50 countries, all across continent in the world. We'll talk about Italy because a ace broadcaster, Gifty Auntie, is there as well. We'll try and link up with her via Skype. Her programs have all been cancelled because authorities there want to reduce the cases of infection. Let's come to the studio and have a conversation. It is certainly scary, I think. But the good thing, by the way, is the rate of recovery. The rate of fatality is fairly low compared with Ebola. But then
compared
there's also
MERS, compared to SARS.
Exactly. But then there's also a very good rate of recovery,
yes,
which we didn't see in the previous ones. You're welcome to Ghana. Is this your first time?
Actually, no. It's probably my 5th.
Oh wow! Yeah. So you're very much used to this system. Let's start with what your perspective is. But well, let me talk to us about Kenya.
I think
Kenya?
As a starter, I would like to correct 2 factors.
Okay,
the list that you were reading, it's a list of confirmed cases by country and region, and when China does the calculation and statistics, it included Hong Kong region and Taiwan region. Okay. And the second one is...
Okay, so quickly, let's just look at that again. Let's just pull that up again and take a look at it. You say that in China, so this is supposed to
mainland
be...
China and the region of Hong Kong, Macau, and Taiwan.
Okay. So this actually gives us an idea. So mainland China, if we look at mainland China, we're looking at 2,744 deaths. You're saying that this includes...
This includes... This is the total death, includes Hong Kong region, Taiwan region, and Macau. But there's no death in Macau. There is I forgot the exact number in... Taiwan and Hong Kong. Hong Kong, it's all single digits.
Okay. Okay. So I just wanted to understand the correction. What we're hearing, this is Hong Kong. Hong Kong has 92 confirmed cases. 2 people have died, and the total recovered is 24.
Yes.
Okay. I just wanted to understand the correction you were putting in. This is Taiwan.
Thailand.
No, that's Taiwan.
Oh, Taiwan here.
Taiwan has 32 confirmed cases. 1 person has died, 5 people have recovered. Okay, I want to understand the correction.
I think first of all those data are from China's Chinese National Health Commission.
Okay.
Because that's the only organization, the authority you can get the right data from.
Okay.
And Chinese government has been very transparent with the data and sharing, like why this data can be upgraded live, because the Chinese government is sharing the data with all over the country, all over the world.
Right. Well, we'll go into details about how countries have managed it, especially about how China has managed it. But I just wanted you to tell us, we know the situation that in Kenya, there were suspected cases as well. How is this, because that's where you're coming from right now, how is the situation there? Are people in a state of panic? How are authorities there managing it?
Kenyans are relatively chill. I don't see any panicking over there.
Okay.
And usually, suspected cases, yes, you do report it. Also, you have to follow up, because most of the time, those suspected cases, they turn out negative. Just like the first alleged case reported in Egypt, a few days ago, probably 5 days, claimed it was the first case discovered in Africa. But then that suspected patient turned out negative.
Okay.
So this proves that this virus is very, very sneaky. It's difficult to test, and also it's difficult to confirm. So you have to wait. Just like the case we found in Algeria, now the first case officially in Africa, it's an imported case, and he's an Italian.
Okay. So let me know from your perspective how this all started. People have said that it started much earlier in 2019 in China. Yes, in China, and people have raised questions. International media organizations have raised questions about how Chinese organizations or Chinese authorities handled it back then. What's your perspective on how this all started and how far it brought us?
Just like anything new or unknown, occurred in any place, people didn't have any information about it. This is a virus that we didn't know. It's called novel coronavirus. So when the first few cases happened in December 2019, there was media coverage, but it's not widely reported because people didn't predict it would become an epidemic. And also the local government, the Hubei and Wuhan government, they didn't pay focal attention to it. That also caused the spread of the virus, and also why the central government of China took command of the whole deal with the virus epidemic, and sacked a lot of the high-rank officials in Hubei province.
Okay, people have said that the Chinese officials were not as open as perhaps they should have been. They say they think that if they had been a bit more open, that perhaps the world could have been on high alert. I'd like to know what your thoughts of that is. And they point out to the doctor who apparently reported it. He reported that he's seen something, he didn't know what it was. They said that the Chinese authorities sent police personnel. I mean, clarify that for us. What really happened?
Okay, so as I said, the central government is sharing the data and information and sharing with all the governments in the world and World Health Organizations. And unfortunately, the local government of Hubei province wasn't doing the best job, and that's also explained why they got sacked and punished. And there was, China has two ways of communication. One way is bottom up, the other way is top down. So China sure can do better in terms of bottom up communication, because there are a lot of bureaucracy happening. And actually, Dr. Li, if this is the person you're referring to, all Chinese pay a lot of respect to this person, but maybe the West and mainstream media didn't mention that he is not the first person to report about the situation.
But when he reported, did the Chinese authorities send people after him to try and stop him from broadcasting what he had found? Did that happen?
I think this is how okay. If you want to compare like how well Chinese government did, you have to compare it. Of course, Chinese government is not perfect if you want to compare it to perfection. But I think the government is doing much better job than a lot of other governments. And if you're talking about, the government sending people running after him, that didn't happen.
That didn't happen.
He was called for a conversation, and he signed a paper saying he's not going to spread unconfirmed information.
Okay.
And that was what happened. The intention behind this, from my own perspective, I think it's just the government is trying to prevent a massive public panic.
Okay, and I mean, here in Ghana, it's one of the things that we're trying to keep a handle on. We were told that there have been 9 suspected cases which have been tested and proven.
In Ghana?
Yes. 9 suspected cases tested and proven negative according to our health officials, some of whom will be joining us in this conversation. So we know about that, but the one key thing we've tried to prevent, and you heard our president say in Parliament, is to avoid the panic. And we'll talk about evacuation. I want to know what you think about it, but let's look at the international community and the response that has come. How does China perceive the sort of response that is coming? Do the Chinese feel that there is a certain agenda out there to paint China black with this, or do they feel that there has been an appropriate response? Everybody's concerned generally.
So I think as the clip you played earlier of the Chinese ambassador to Ghana, he mentioned there are some countries, they shut down trade or they put some trade restraints on China, and I think if you compare it to other epidemic or pandemic that happened to the global society, you would understand why this kind of approach is not appropriate. For example, 2009, H1N1, aka swine flu, hit Mexico, then America, then spread to the global society. You know how long it took American government to accept, to announce it's a national emergency? The data is there. It took American government 6 months. And you know how long did the American government and WHO to announce it's a pandemic, we're going to stop counting cases? It took them 2 months. So you can compare all those. And the response from other countries, no country said, we're going to ban Americans from entering our countries. We're going to close our borders with Americans. We're going to ban trade with Americans. Nobody ever said, if you recall, 2009.
But this is certainly this is a virus that we don't know much about. We're still learning a lot about it. And people know that, look, when Ebola happened, for example, Ebola happened in an African country. And between that African country, and I'm using Ghana as an example, between that African country and Ghana, our interaction is not as much as we interact, Ghana interacts with China at the moment. So isn't it only fair that people will look out for, you know, their citizens and say, until we know what this is about, let's put in some restrictions. Isn't it just fair and right?
Of course, you want to take care of your own citizen, but at the same time, get the full picture. You know what Chinese government and Chinese embassy advise its own citizen who are migrant workers, who have their jobs and companies to take care of in African countries. They ask them, stay in China as long as possible. But if you have to resume your work, okay, impose 2 weeks of self-isolation once you arrive, and also report to the Chinese embassy. And that's the step you take when you travel out of China. And there are more procedures to go before you travel out of China, because different regions in China now, they have different policy of this quarantine. Like the data you mentioned earlier, you forgot also to mention the trend. There are good news there. You know, since mid-February till now, the new confirmed cases are declining.
In China?
Yes.
Because it's actually going up elsewhere. For example, if you look at
like
Italy,
yesterday, outside of Hubei province, there were only 3 cases within China, the whole country, 3 cases new.
Outside of Hubei province.
Outside, and inside Hubei there was only 25 or 24, I forgot. It's around there, less than 30.
Okay, so let's take a look at the figures again. Let's go back to the data and see what it says. So if you go to the data, we're looking at mainland China. We have a breakdown we have a breakdown there. So there's what's happening in Hubei, mainland China. 2,641 is saying that there haven't been any new deaths in, there have been a number in Hubei, but so apart from Hubei, which is at the top, all the other provinces here have not recorded only 3 deaths.
No, 3 new confirmed cases.
3 new confirmed cases. So no deaths were confirmed yesterday?
There were 40 some deaths, new deaths.
Okay. But then only 3, and for you, that means there's something good happening?
Compared to before, yes, the data is looking better and better. It means the efforts, the Chinese government and all the Chinese medic staff working on the front line, their efforts paid off.
Okay.
You see, and the quarantine policy paid off. All the great cost people in Wuhan, including all the international community who's staying in Hubei, their efforts paid off. So the transmission of the virus slowed down. Okay. That's why you discover less and less confirmed new cases outside of this epicenter Hubei. So if you only report the total number and you ignore the trend of this virus, it doesn't help the public to understand the situation very well.
Which is why I took my time when I mentioned the figures to indicate the trend and what the numbers say about the trend when I was going through it.
So let me continue what I wanted to explain. So because of this situation is changing, it's fluid, it's changing every day. So Chinese government is trying to balance, the quarantine policy and the resumption of work and production, because life has to continue, right? Yeah. We cannot stop the whole country than how people make a life. And that's why recently President Xi, he's issued new policies, and it's not a one-fits-all policy. He says, okay, now we have 34 provinces in total in China. That's like, and you see the space.
Yes.
The country is massive.
Exactly.
Yes.
So
now there are regions with high risk. There are regions with medium and low risk.
Okay.
So for the low risk regions, the government advised them to resume work and production actively in an orderly manner.
Okay, help me now. Let's go back to the data.
This data really doesn't show, because you have to see the trend.
Okay, I wanted you to help me with, because you know the provinces, to help us, to give us an idea which, if you do know, which areas are high, which areas are medium.
So if you see the map, the center, it's covered by red. You don't really see.
So that's like where
if you can find Hubei province, so use that as. No, Hubei is there. Hubei is down, more down. Okay, can I move?
Yes, you can.
Okay, let me show you. So Hubei is here. Okay, this is Hubei. He's literally located in the heart of China.
Okay.
So now, one circle around it, this region are medium risk. And further, these are low risk.
Low risk.
Yes, like especially on the coastal area, and here, there's no new cases for a long time.
Okay.
Especially the southwest part.
Okay.
Like Tibet. It's reported no new cases at all for 25 days. And the WHO said if you declare no new cases for 28 consecutive way, it basically means the whole region is safe.
It's safe.
Yes.
Okay.
This is a rule for all the transmitted disease.
Okay.
Disease control.
Okay.
So for the high risk region, Hubei.
Yeah.
The government advised them stay extremely alerted and fully committed to the disease prevention and control.
Right.
So no resumption of work, study, or production.
Okay.
So
that's the Hubei province.
Yes, yes. So people are still under lockdown, but only people. There are few type of people are allowed to go out of the province, which are people who has career related to the livelihood. Like for example, they work on the electricity, water, food supplies, medical supplies.
Essential services.
Yes, yes. So for the medium risk regions, the government advised them to resume work. In a very orderly and cautious manner. Okay, because they have, at the same time, they have to forestall the imported cases. And for the low risk areas, all these areas reporting no cases, still remain alerted, but they have to shift their focus from the prevention and control to fully resumption of work.
Okay, we're trying to open it up further for you so you can give us a clearer idea of the safe areas.
Okay, here's Hubei, this is Wuhan. Okay. So like here, Zhejiang province, Shanghai, Jiangsu, these are the regions are relatively safe. Yes.
Okay.
So yesterday, the only 3 provinces that reported 3 new confirmed cases are one, Beijing City, and one is Shandong province, and the other one is, I think, in the south. I don't remember exactly. So the majority areas of China now don't have new cases. Yes.
Okay.
So we would like to say this epidemic is under control, but unfortunately there are hotspots outside.
Now I think that's then the focus of the discussion. Now we're looking also, of course you can't answer for what's happening in Italy, but if you look at Italy, we're seeing a rather rapid growth of the spread in Italy. Now Italy has become 1, 2, 3, the number 4, actually number 3, because the third one is others, which is not a particular country.
It's the cruise.
Yeah. So Italy has become like the 3rd country. I mean, we know that the death rate also in South Korea has been very low.
I think I can talk about South Korea since it's a very neighboring country.
Right, go ahead.
See, yesterday, 528 new confirmed cases reported in South Korea. And the number in South Korea all of a sudden spiked from 1,100 to now 1,700.
Why so?
It's because the government didn't take a strict quarantine policy as Chinese government did.
Okay.
Maybe there was some concern, or maybe it's the social structure is different. I'm not blaming them.
Okay.
Every country has their own situation.
Okay.
But it proves that if you don't pay attention, this virus is very sneaky. It can spread in one night. And it's there's a super spreader in South Korea. It's a 61-year-old woman, and she knew she's sick. She was having fever, mild fever maybe. She still insisted on going to church, attending her religious events. So she's transmitted her virus to all her church members.
So you're talking about being careful, and I like that you say that, because I want you to talk us through. You've been to Ghana.
Yes.
You came from the airport. I want us to compare that with the measures that are being implemented in China, and give me your thoughts. So that's a material that Wuhan is looking to share to reduce the level of panic. Depending on how you look at it, you can call it a propaganda material. You can also call it a material that's supposed to ease the panic and give people the strength to go on with their lives. I still have here in the studio Xuejia Gu, but I have on the line Director of Public Health for Ghana's Public Health, Dr. Bedu Sarkodie, who's joining us. Like I said, we're looking also at Ghana's own preparedness, and we'll try to see what we can learn from China. But Doc, thank you very much for your time this afternoon. It looks like we've lost Dr. Bedu Sarkodie. We'll try and reconnect with him. But so, like I said, depending on how you look at it, people can say, well, this is not very realistic. It looks like you're showing us a very beautiful picture. Is it not?
I think you
propaganda?
didn't look at this video very carefully and just jump to the judgment and call it propaganda. It's actually made not by our...
Hang on. Don't get me wrong. What I'm saying is, depending on where you stand, you will look at it where you and I'm not. And
the intention of me wanting you to show this video to your audience is for people to see how quiet the city now became from a bustling city.
Sorry, I have to interrupt you briefly. I do have Dr. Bedu Sarkodie on the line to get his perspective, or for him to tell us what Ghana's preparedness is. Dr. Bedu Sarkodie, thanks for your time this afternoon.
Thank you. Good afternoon.
Right, good afternoon. So we're talking about coronavirus.
Can you make it a bit louder for me?
Okay.
Hey.
We're talking about coronavirus. We're looking at the rates and how, for example, China says it's recorded very low rate of spread. But we're also looking at a very concerning situation in Europe.
A bit louder, please. I can hardly hear you.
Okay. Hello, Doc. Can you hear me? Is it better now?
Well, that's good.
Okay. So I'm saying that we're talking about coronavirus, and we're looking at the trend in China. China says it's recording lower and lower rates of spread. But we're also looking at a very concerning situation in Europe. We're talking about Italy. I know at least 3 people who have traveled to Italy from Ghana who definitely will be returning home. What is our plan like? You talked about a plan earlier that we were following. Is that being enforced? And what is our plan if there should be an outbreak? Has there been any review so far?
Yeah, the plan is as much as possible based on the emerging events. Then we can further strengthen whatever we are doing. It's true that China, they are recording lower and lower cases. And I think last week, the analysis indicates that about 90 to 95% reduction on the rate of new case development. But then it's also worrying that we are having cases in quite a lot more areas. So what we need to do, the various surveillance structures at the points of entry, which day in and out, we keep doing more to further strengthen. And then also to strengthen the surveillance systems within the country.
When you talk about surveillance system, exactly what is it that we're doing?
We have case definition for suspected case, and we use that to detect and find out if a case needs a suspected case for further investigation. And with that, we have used it to get about 24 suspected cases. A lot of them are negative. So the difficulty is when there is a case and you allow it to spread wide. So within at the points of entry, crossing our borders, and then also internally, the various structures to monitor disease, including the COVID, are being enhanced, and we are watching those things very closely.
I'll draw your attention quickly to a situation at the Tema General Hospital. Tema General Hospital is one of the designated areas, holding areas, should there be any suspected case, we understand. But
we have developed the treatment center and has been ready since as early as we set the system into alert. So it's not the entire hospital. There is a side of it that we have this treatment center.
Yeah.
So we have a treatment center as part of the National Response Preparedness Plan.
I was just drawing attention to a situation there. Now, we have gone there, and what we know that one of the key ways to stop or prevent, we're told, to prevent the spread of this virus is to keep washing your hands, as regularly as possible. What we can report from that part of the Tema General Hospital, which has been designated to deal with coronavirus, is that there is shortage of water there. Has this come to your attention, sir?
Well, within the facility itself or that part of the city.
Say again?
No, I want to be very clear of the issue you are bringing up so that if you need to follow up, you will. You said is it within the hospital, within the center, or that area of the hospital? Within the treatment center, within the entire hospital, or within the area? Because the people there have not reported to us any shortage. That's why I wanted to be very definite.
Okay.
If it is our system, we need to strengthen. If it is general system that we need to reach out to others to assist, that's why I'm coming after. But then we have had no report of shortage of water in that area.
Okay. Perhaps you want to have your people take a look at that or go there to make these checks. But
yes,
we know for a fact.
That is well noted. Thank you.
We know for a fact that there isn't. I'm not quite sure how widespread it is across the Tema metropolis, but we know that where it's designated to take care of people with suspected cases, there is no water there.
If we have to provide bunkering facility, to provide overhead facility to serve water, I think it's important that at this area we have regular and consistent supply of water.
Okay. I followed conversations going on in the United States of America. They've also recorded a number of cases. Thankfully for us, the cases we recorded have all proven negative. We also said that we're committing an amount of, I think, 2.5 million cedis. I'm not quite sure how it is going as far as disbursement is concerned, the things that we need to buy. Can you give us an update on that?
What we have one day in out, we keep revising our plan. We have a very short-term, immediate needs that urgently we need to do, and then up to about 2 months, 3 months. Based on the scenario, what will happen, we will have to revise our plans and budget. Indeed, what the 2.5 you mentioned is not the budget for this preparedness and the entire budget. We were given this as the kickstart. We have further worked with the partners, and we are just looking and watching closely based on the observations. What do we require? And we have had further discussions with the partners. Some of them are providing support in terms of time. Some WHO has provided PPE. It was good that the government showed the leadership to give initial start and own this response preparedness plan. Others are also looking at what we are doing as a country, providing technical support, providing logistics support, and based on what would be the health needs, we've submitted this thing through the Ministry of Health to Finance, and I believe it might have gone to wherever the highest level of the presidency. And as much as possible, we are working with what has been provided. We believe that working with the partners and providing the technical support, providing the logistics support.
Okay.
Should there be the need, I don't believe that we would be made to just found wavering.
Well, I don't know how Ghana sees it, but I know for a fact, because I followed yesterday what was happening in the United States, that they are already, they're saying that it's not a matter of if, it's a matter of when. It's not a matter of if, it's a matter of when this becomes a pandemic. And so they are already budgeting some $2.5 billion to deal with this. Is this our position, that it is not a matter of if, and that it's a matter of when? I'm just sitting here in the studio with a Chinese journalist who has said that if you look at South Korea and how it happened, it looks like there has been a higher rate of death in South Korea because from her perspective, authorities did not put in the necessary interventions to stop this spread and from people dying. What is our own position? Is it for us a matter of if or when this becomes a pandemic? We are preparing for the worst
and we pray for the best.
We are preparing, sorry, say that again.
As a country, you have to prepare for the worst and pray for the best.
We are preparing for the worst and praying for the best.
Meaning that whatever we are doing, we have to do best, that it doesn't happen. But then should it happen, we are preparing for the scenario. That is why the plan that we have taken care of the worst case scenario.
Okay.
Should it happen, we should not be seen having been taken by surprise.
By surprise,
so
certainly.
That's our plan as a country. But then, as matter of fact, because it's a preparedness and we have not had the case yet, we still have to monitor very closely so that we balance the various options as much as possible.
All right, sir. I'll let you go. But before that, I just have a very quick question. Now, we just played a video from Wuhan. It's one of the things that you do in any potential pandemic is to reduce the level of panic and to make sure that people stay afloat with information that helps them stay safe, but information that also doesn't create panic. We haven't seen any of such videos or such radio broadcasts or jingles or anything in Ghana warning people about this.
Jingles have been prepared, and I mentioned several that we have jingles in English being translated, and we have a unit, one of the units and the pillars of our preparedness plan is social mobilization, risk communication. They are working very closely on this, and they have this in English. They have sent it for translation into the local dialect.
Okay.
And if you go to the airport, we started giving messages, and these are being broadcast. So within the country, I think I am aware that these have been prepared and being translated for further broadcast through the various small communication units and pieces at the regions, districts, and to the community level.
I see. I'm yet to see or hear. I'm personally yet to see or hear any of those.
I've cited pamphlets. I've cited pull-ups. So there are a lot of many other things that have been done here, and we need to appreciate those things as well.
Okay. Thank you very much, Doc, for your time. But like I said, I have personally not seen or heard any of those. Hopefully we will hear as we go along. Dr. Bedusa Kodie is Director of Public Health there talking to us. Thank you very much for your time once again. Let's wrap up with you.
Thank you. I would like to add up after listening to doctors' information. Like the successful, suppress of this virus spreads in China, it's not, the credit doesn't only go to the government's, central government's strong policy. The credit goes to all these people who are cooperating with the government's policy, and also goes to all the media who actively report on the front line and showing people what's really happening, and also sensitizing people non-stop.
Okay.
So I think all the factors contribute. If any factor doesn't, cooperate, it won't work.
Right. I just have a little time left, and I need to wrap this up. But what I meant with the video was that from where you stand, you could look at it and say, well, this is a propaganda message. But you could also look at it as a message that's meant to uplift people and reduce the level of panic. And you heard me ask the doctor there what our own plan is. I haven't seen any of that here in Ghana, baby, because it's not that close to us. But I want to find out from your perspective, how is this affecting people? China has done the Chinese embassy here in Ghana has done several press conferences trying to say that this is not, the economy is still robust. but we know that this is certainly affecting China. How is it affecting China economically, the socio-economic fabric of China? And then you can wrap up with lessons for Ghana.
Of course, such epidemic, unpredicted, hit a big country like this. It surprised us when we're not prepared, and because of this remarkably reduced consumption and paused productions, and the Chinese, and also stopped people's movement. Of course, the social development and the economic activities hurt a lot. And you would see that after 1 month, and when the Chinese government released the data of the first quarter of GDP growth, you would know. But luckily, it happened in the beginning of the year. We still have time to make up to it. And with all those policies issued by the central government, and with cooperative people and motivated people, and I don't see a problem that we're going to catch up with our estimated growth goal. And also, so do the WHO and a lot of economists in the world. They say Chinese, yes, the economy is big, it's enduring. The fundamental won't be shaken just like that.
Certainly, the Chinese economy is attached to a lot of other economies, so we certainly hope that it gets better finally. I was asking you earlier, you came through the airport, and you can tell, better speak to what happens at the airports in China and all the other countries that are connected. What are your thoughts on how you're screened?
Because it is happening in China, so it's extremely strict. Everyone relate to this event. It's not like I'm watching TV news, it's telling someone else's story. It's happening on every one of us. So everyone has this strong sense of responsibility, including the airport's immigration staff and all those travelers. Everyone is wearing masks.
I want you to compare what happens in China.
Here, I'm going there. So in Ghana, where I come, I think because it's still happening far away, so you don't have this strong sense of, this. I'm not trying to provoke panic.
This is what you saw. This is what you went through.
But I would like to see, people well trained. Like I always tell the airport staff I interacted with, I say, okay, you're wearing a mask, but if you don't put your mask properly, you're wearing nothing. You're just wasting.
Did you observe people who weren't wearing their masks properly at the airport?
Unfortunately, it's not all of them wearing
of course,
the mask properly. Some of them, they pull the mask down, they show their nose, then you lose your protection. And yes.
Apart from that, which other thing did you observe? And you are from China, so you know the situation there properly. So I just wanted to compare what you saw at the airport and what you see happen in China.
I saw at the airport that not everyone is doing their protecting themselves 100%. And this is a little bit concerning. But I think with proper training, especially from the government and also from the media sensitization, if you broadcast more content on what this virus is about, what we can do to protect us, instead of just criticizing others or looking for other, eye-catching topics, it would help people more.
Well, that has been our focus here at JoyNews. You certainly know that we always remind you of what the things you can do to stay safe. We'll continue doing that. It's been a very insightful conversation. Xuejia, thank you very much for coming. Xuejia Gu is a journalist with CGTN, bringing us perspective not just from China, but also from Kenya, and also her experience at the Ghana airport. I wish that we'll have a lot more time because there's still a lot more that we can talk about. Let's do a very quick break here. We'll be right back.